let's talk about if and when a person did have a root canal. Why is it so important that he should be putting a crown over this root canal kind of right away? Tell us, please.
Sure. Root canal therapy is the process in which we're removing the nerve from within the tooth structure, along with the blood vessels that travel with the nerve. It's a very unfortunate event that a patient would need a root canal, but we see quite a bit of patients needing root canals due to decay or breakage of tooth structure, things of that nature, deep fillings that were done many years ago. So when we're performing root canal treatment...
Can I interrupt you? Something comes to my mind, if you don't mind.
Sure.
Is it true?
Absolutely.
I've heard one time that once a person has a relatively severe toothache, not just a little hot and cold sensitivity type of things, but a relatively severe toothache, that in almost all cases that spells root canal. Is there any truth to that at all?
Well, yeah. See, what happens is a toothache is normally caused by trauma, but more so bacterial invasion or carious lesions, as we call it, which is commonly known as a cavity. Now, if a cavity is small, it's far away from the center of the tooth where the nerve lies. As this decay grows bigger and bigger and bigger, it gets closer and closer to that nerve chamber in the middle. Now, as you're very close to it, that's when patients usually start experiencing sensitivity in a not so normal fashion. And once you break open into the nerve chamber, obviously you're in direct contact with the nerve, which is in the center of the tooth. That's where pain comes. So by the time a patient has complained to the dentist of having a good amount of sensitivity / discomfort, you're very close to the nerve, if not into the nerve chamber. So 90 to 95% of the times that warrants the removal of the nerve or a root canal treatment. Now, that being said, going back to your earlier question, when we perform a root canal treatment, we are essentially hollowing the inside of the tooth out to getting to the center where the nerve chamber lies. Once we have removed the nerve, we will fill that chamber up with a sealing material, and then we will put a buildup material in the tooth. You still have a very thin shell of tooth structure around this buildup material. And that being said, what tends to happen is if we went ahead and let the patient go home with simply just a buildup in a tooth that has been root canaled, upon chewing over the course of the next couple weeks or months or days even, that tooth structure is going to break. And to prevent that tooth structure from breaking, it is always, always strongly recommended that a patient put a crown or a cap on it, so to prevent the breakage of natural healthy tooth structure, which could eventually lead to the loss of a tooth.
And I've heard that when such a thing happens, that the tooth can break. Why? Because it's a pipe now, and the pipe, it's not a full tooth anymore. It's now a hollowed out thing, so it can break easier.
Correct.
And of course, I'm sure that some root canals or some procedures, due to how much was broken, how much was rotten inside already, need a more hollowing out than others, which demand more of it. But I have often heard that once then it breaks, with a little bit of luck, it breaks somewhere up on top of it, and you just go and put a thing on it. But often it can also break literally below the gum line and create apparently quite a problem.
No, you're right. There's one thing that we as dentists are never going to be able to predict is how a tooth is going to fracture or it's going to break. Vertical fractures are something that, are never a good thing. Any sort of fracture is not a good thing, but the vertical ones that run straight along the long axis of the tooth, as we say it, are the worst ones, because any sort of a biting motion, anything that you may, and it doesn't have to be hard. You could go home and have a peanut butter and jelly sandwich one day, and the tooth has now chipped or fractured or broken right down. And you're correct. If it does go deep enough, close to the bone or close to the root structure, there is a very, very strong possibility of losing that tooth, which will eventually need to come out.
Got it. So obviously people should follow their doctor's advice and cover it.
Always there is a madness to our doing, and there's a very good reasoning to why we do things, and it is for the good of the patient in the long run. Absolutely.
Well, you know, as patients, number one, you know, I don't even know anymore, because the last, I don't know, 40 years now, if not, yeah, about 40, 44, some 45 years that I have gone to a dentist, if and when I went to a dentist, it was never painful. It was never painful. And yes, I you know, I had an I mean, I actually had a fair amount of little work done, which theoretically should be, it was never painful. Now, I do remember, however, when I was about 19 or 20, some 45, some more than years ago, I do remember that dentist having a needle. I'm telling you, it was a pipe. It wasn't a needle.
Absolutely.
It was short. It was about 1 centimeter long, and he's right in between. Oh, it was, I'm telling you, it was so hurting. It was unbelievable. And,
sure.
But this doesn't happen anymore. So either way, we have an apprehension of doing any and all little work. And then there's the fact that you have to pay for it. So we sometimes, you know, kind of say, well, I guess he says so because it costs money. You know, we do that with all people.
Absolutely.
My service, we do it with car mechanic, we do it with everybody. Because the reason you say I need it is because you make money. And while here and there, you know, that may be, the truth is I've noticed most people do not operate. They sell what they need to sell, and they do just fine, much better that way than overselling. It's nevertheless not easy. There is we don't want the work done because of, oh my God, and then there's the financial condition, and sometimes it's very real. Even if we believe we need it, it is very real.
Sure.
And then we go and prolong it, and nothing happens, a month, a year, and next thing you know is you don't do it for a long time, you know.
No, you're absolutely correct. You know, over the years, technology has made the care that we present to patients a lot more comfortable. On the same token, technology has also made the quality with which we care for the patients a lot better from the dentist's end. But yeah, no, you know, you mentioned that there are reasons for patients not coming to the dentist or not wanting to go to the dentist. And the three main reasons are, look, money, fear, and time. Technology has come such a long way, and in a state-of-the-art practice such as ours, we have taken that fear component almost down to a very minimal to, like you said, none. As far as money and time concerns are concerned, from a financial standpoint, yes, dentistry is not the cheapest thing out there, but you know, here we offer many payment plans to patients, which makes it a lot easier for them to have affordable dental care. And as far as time is concerned, we've taken care of that as well. We have weekend hours, we have evening hours. Look, we're all working individuals, and we do not wish to take time away from work, lose the wage, go to the dentist, pay the dentist, and you know, you lose more wages. So time is always a big factor, and we've looked at every angle to getting that satisfaction for the patients.
Wonderful. Well, as you have mentioned in another video, but the philosophy of your practice of really pleasing, and you have a big practice, and you have 95% of people really feeling comfortable, and that in a dental office, it's really something. So I'm sure that your extended office hours have a tremendous amount of things to do with that. Thank you very much, Dr. Patel.
Thank you.